Hello, my name is MaKenzie. I'm going to be your nurse today.
Hello.
Your hands. I'm going to do a physical assessment on you if that's okay.
Okay.
Okay, let me see your wrist. Can you tell me your name and date of birth?
Logan, 93.
Can you give me allergies?
Dr. Cycle.
Okay, matches. Can you tell me what city you're in?
Madisonville.
Do you know who your current president is?
Donald J. Trump.
And do you know what today's date is?
October 12th.
Okay, perfect. Patient is alert and oriented. Everything sounds good. I'm going to go ahead and get a set of vital signs on you. Does it matter which arm I go in for the blood pressure?
No.
Go ahead and do your right arm. Blood pressure is 134/82. Are you having any pain today?
No.
Okay, on a scale of 0 to 10, 0 being the least, 10 being the worst. 0.
Zero.
I'm going to go ahead and get your radial pulse by your wrist. Okay, pulse is an 84, respirations were 16. Everything seems good, so I'm going to go ahead and I'm going to wash my hands and I'm going to put gloves on. Okay, I'm going to have you stick your arms out in front. Okay, upper extremities are symmetric. Go ahead, check your cap refill. Less than 30 seconds bilaterally. Skin is warm and dry. Color is appropriate for ethnicity. I don't see any lesions, bruises, anything abnormal. Skin appears to be intact. So everything looks nice there. I'm going to have you sit your hands down. I'm going to go ahead and check your skin turgor. I'm going to pinch up slightly right here. Okay, perfect. No tinting. Everything appears to be good. I'm going to go ahead and look at your hair. Lean forward for me. Okay. Hair is evenly distributed. Scalp is white. I don't see any lesions or anything abnormal. No dryness. Everything appears normal. I'm going to go ahead and I'm going to check your temporal arteries. Okay, those are grade 2 plus. I'm going to go ahead and check your carotid while I'm here. Alright, grade 2 plus bilaterally. Everything feels fine. I'm going to go ahead and feel your frontal and maxillary sinuses. Just tell me if you feel any tenderness. Anything?
No.
Okay, everything feels fine. Head is appropriate, size and proportional to body. Everything looks good. Ears are also proportional and appropriate size to the body. I'm going to go ahead and look at the external structure of the ear. I don't note any battle signs. I don't see any drainage or redness. I'm going to go ahead and look inside. Alright, like I said, no redness, no drainage, no lesions, masses. Everything looks perfect bilaterally. I would check that. I'm going to go ahead and have you cover one ear. I'm going to step behind you and say a 2-syllable word. I want you to repeat it back to me, okay?
Football.
Perfect. Bilaterally, I would do that. That's cranial nerve 8, intact. Perfect. I'm going to go ahead and look at the eyelashes, eyebrows. They're evenly distributed. They're symmetric. Everything looks good there. I'm going to get my pen. I want you to follow it, okay? With your eyes. want you to look at me. Okay, very good. Alright, sclera is white, conjunctiva is pink and moist. Cranial nerves 3, 4, and 6 are intact. Their perla pupils are equal, round, reactive to light, and they're accommodating well. So everything matches there. I'm going to go ahead and measure your eyes. Can you take your glasses off one more time for me, please? Pupils are a size 4, symmetric, equal, both pupils. Do you have any issues with your nose? Feel it? Any tenderness?
Mm-mm.
Okay. Nose is symmetric to the body. Can you look up for me? Alright, septum's not deviated, pink and moist, no drainage noted in the nasal mucosa. Everything appears fine there. I'm going to have you close one nostril. And can you smell? Tell me what it smells like.
Alcohol.
Perfect. Bilaterally, I would do that. That's cranial nerve 1, so that's intact. Can you puff your cheeks out for me? Can you smile? Can you frown? Perfect. Cranial nerve 7 is intact. That's nice. Gonna have you open your mouth. The eye. Tonsils are a grade 2 plus. Teeth are all accounted for. Pink and moist. Oral mucosa. I don't see any white patches. No lesions. Like I said, all of his teeth are there. Can you stick your tongue out? Can you move it side to side, up and down? Okay, can you swallow? Alright, perfect. Cranial nerves 9, 10, and 12 are intact. Can you look up for me? I'm going to swallow, please. Feel your trachea. Trachea is midline. Don't notice any JVD. Everything looks good. Can you take your head, move it circles for me? Range of motion of the neck is nice. I've already felt the carotids. Both carotids were a grade 2 plus. Everything's fine there. Can you shrug your shoulders for me? Perfect. Cranial nerve 11 is intact. So I'm going to go ahead and feel your chest. Do you have any tenderness?
No.
Okay. Can you take a deep breath? Okay. Ratio 2 to 1 effort of breathing is normal. I'm going to go ahead and step behind you and have you take a deep breath when I get back there. In a second. Deep breath. Alright, it's moving equally. Everything appears to be intact. I'm going to go ahead and listen to your lung sounds. One, two, three, 4, 5. Okay, that was the front. I'm going to go ahead and go to the back. Alright. Find a shoulder blade. One, two, three, 4, 5, 6, 7, 8, 9, and 9. No adventitious lung sounds. Bilaterally, lung sounds are clear. While I'm here with my stethoscope, I'm going to go ahead and listen to his heart sounds. Alright, right of the sternum, second intercostal space is, I'm going to do aortic. Go over to the left, second intercostal space. Pulmonic. Third is Erb's point. Tricuspid is fourth intercostal space, and then I'm going to go fifth intercostal space, mid clavicular. I'm going to listen to his apical heart rate for a full minute. Okay, S1 and S2 are noted. Heart rate was 82 beats per minute. So like I said, normal sinus rhythm. Everything sounded good. Strong heartbeat. Next, I'm going to go ahead and check your range of motion in your upper arms. Okay, so I'm going to have you on this side. Can you roll your shoulder backwards, forwards? Alright, joints, no crepitus noted, range of motion, full range of motion in the shoulder. Can you do your arm like that for me? Full range of motion in the elbow, no crepitus noted. Wrist, can you roll it for me? Perfect. No crepitus, full range of motion in the wrist. I'm going to check your fine motor. Can you take your fingers and touch your thumb and go backwards? Perfect. Everything's good there. I would do bilaterally, range of motion. Can you hold your arms up like this for me? Alright, pull against me. Push. Squeeze my hands. Alright, muscles are a grade 5. Everything appears fine there. I'm going to go ahead and have you lay back for me. On your back. Alright, I'm going to inspect the abdomen. Everything looks flat, no abnormal pulsations. Nothing abnormal noted just by looking at it. So next I'm going to listen to his vowel sounds. Right lower quadrant. And work my way in and in. Okay. Vowel sounds are active in all 4 quadrants. Everything sounded nice. Next, I'm gonna, have you had any changes in your urinary
No, ma'am.
habits? When was your last bowel movement?
This afternoon.
Okay, perfect, normal there. While I'm down here, I'm going to go ahead and feel your hip bone. Can you please extend your leg out towards me? Okay, perfect. Can you bend your knee up? Perfect. Can you roll your ankle? Alright, joints are no crepitus noted. Joints feel fine. Full range of motion in the hip, knee, and ankle. I'm going to go ahead and have you sit back up for me. Alright, I'm going to feel your brachial. Alright, 2+. And then, like I said, radial is a 2+ as well, like I did earlier. I would do that bilaterally. I would also do his range of motion bilaterally, in joints as well. While I'm down here, I'm going to check your strength and push. Okay, cool. Okay, perfect. Push up. Push down. Alright, strength is a grade 5 bilaterally. You take your shoe off for me. I don't note any edema while I'm down here. Both legs look fine, everything. Once again, skin is intact, normal color. I'm going to go ahead and feel his posterior tibialis. Alright, it's a grade 2+. Dorsalis pedis here. 2+ as well. I'm going to look at his toenails, no fungus noted. Everything appears normal in the toenails. Bottom of his feet, no dryness, no flaking. Everything looks good as well. I'm going to go ahead and check your calf refill too, just on your toes. Less than 3 seconds, that's perfect as well. Bilaterally, I would do all that. Like I said, I think that concludes my physical assessment. I'm going to take my gloves off, wash my hands. I would also document everything. The pulses were all 2+. His strength was grade 5. His cranial nerves were all intact that I checked, and just document everything. And thank you very much.
Thank you.